I pinch myself every day about how fortunate I am to be working here at a medical school and a clinical system that really care about the value of primary care. I've got my own family doctor, and as a patient, I know that it's important to have somebody who understands me, who knows me, who can guide me through preventive care, who can take care of my medical problems, understand my psychological problems.
I came to medicine with a desire to be a person's doctor, to be able to take care of whatever problems they brought through the door. And then as I did my training, and then I delivered their babies, and then I took care of their in-laws, and you get a profound understanding of what someone is like as a person. I think those who come to medicine with a desire to participate in social justice are going to get a lot out of this kind of a job. I mean, some people join the Peace Corps, and some people go into politics, but this is sort of my own personal way of trying to save the world on a day-to-day basis.
It is a very exciting time to be a primary care physician. Clearly there are a lot of changes that are coming along the pike in terms of healthcare overall, but one thing that I think is consistent is the fact that people need someone to help oversee their overall health. And as a primary care physician, I think we're uniquely situated to be able to help people do that.
It's a great time to be involved and to be getting involved in primary care. As we change the way we deliver health care, looking at treating populations of patients instead of patients individually. We now have patient-centered medical homes. We have accountable care organizations. So we're actually being recognized and are going to be reimbursed for a lot of the work that we've been doing. And we also have a place at the table of how all these changes are going to happen.
I love working in a community health center because I feel like we're addressing multiple causes of health problems, societal causes and psychological causes, in addition to just medical causes. And I think we're really helping people feel better. I get to hear about patients' lives who come from all over the world, come and tell me what it's like to have been where they were and now to be where they are and part of our community in Worcester.
As an educator, it's a real kick for me to get students or residents out of the classroom and out of the laboratory and out into the real world, learning from the people who really do it the best.
The exciting thing about being a pediatrician these days is all the advances that have been made in healthcare for kids and disease management. And so a lot of kids who, would have had serious chronic illnesses, even 5, 10, 20 years ago, can now be really managed at home. These kids who might have wound up in an institution are now with their families, and so I can help their families keep their kids in their homes with them so that the families can take care of them and be with them.
Certainly the reason I decided to become a primary care physician was because of my medical school education here at UMass. I think the medical school has always had a good emphasis and a strong emphasis on providing primary care to the Massachusetts community. And I'm really fortunate, and I feel very lucky to be back at UMass to practice primary care here and to help work with the medical students to help hopefully motivate some of them to enter primary care as well.
It's never been more stimulating or gratifying to be a primary care doctor. You will never, ever get bored with the challenges that you see. And it's not just a job, it's really a privilege. We get up every day excited about going to work and to be with our patients.